I had breast cancer and the role of estrogen in breast cancer. So as you see on my poster, I have the abnormal pathway and the regular pathway of estrogen in breast. So let's look at the regular pathway. So the estrogen, which is E2 in a regular pathway and a regular breast, E2, which is also connected to a GPER. This is basically just a G protein that helps regulate the estrogen in the breast. The estrogen goes through the membrane, and it either binds to A or B, which is alpha or beta. So you can have E2A or E2B. And when it binds to these two, A and B, alpha and beta, they travel through the membrane. And this is a DNA helix to basically show, like, once it comes through the membrane and it binds to either one of these four proteins on the DNA helix, it basically helps regulate and lowers your chance of getting breast cancer. So when it binds from A and B, they drop out of the membrane, they go to the DNA helix. On the DNA helix, you have TF, CA2+, EREs, and CR. These four help regulate the amount of uncontrollable cancer cells that you can get. And I have a boob here. These are the estrogen receptors on the boob, which, as you see, they're very light, but they're yellow lines that lead to the nipple. They show that with these, since you have four proteins, they help limit the amount of uncontrollable estrogen that is allowed into your boob and into your nipple. Now, if we look on the abnormal pathway, we also have another ER+. But as you see, the GPER is not connected to the ER+, meaning estrogen is dropped at an uncontrollable rate on this one. So the estrogen goes down to the PI3K. The PI3K can lead it to ERK1 or 2, which is proliferation survival, meaning as many cancer cells that it creates, they most likely will survive. Now, going back up, because there's another pathway, you go from estrogen positive, which is about 80% of what, women have. You go from estrogen positive to the PI3K. The PI3K then goes to AKT. The AKT drops down through the membrane, and you go to mTORC1, which is cell growth of cancerous cells. Now, I have another boob here that I have 4 estrogen receptors on here, and as you see, the lines are a lot more crazy. That's because the estrogen is not controlled in an environment. There's only 2 proteins that it can drop to, and those basically both create cancerous cells. So as you see, there's more lines, and as it grows uncontrollably at a rapid rate, the estrogen gets into the boob and into the nipple, and that causes breast cancer. On this poster, I put background information about about breast cancer. It's basically the most common cancer diagnosed in women. Men can get it too, but it's not very likely. I wrote the 5 mechanisms of breast cancer: metagenesis, nuclear hormone receptor signaling, epigenetic reprogramming, modulation of immune function, and microenvironment model of carcinogenesis. And I also wrote some treatments down on here. The treatments range: you can have surgery, or you can have therapy, chemotherapy, hormone therapy. And I also wrote red flags, just because most women don't know how to check for breast cancer in themselves. Although you can get treated for breast cancer or any type of cancer, most likely 9 times out of 10 the cancer will come back.